All right, let us quickly move on to our next speaker, Dr. Adebisi Oyero, MBBS, MSc Sexual and Reproductive Health. She graduated from Ladoke Akintola University of Technology in 2013, where she obtained her MBBS degrees. She then proceeded to the University Teaching Hospital in Ilorin as a medical officer for her youth service. Her passion for women's health, particularly fertility, led her to pursue another degree in sexual and reproductive health at the University of South Wales, United Kingdom in 2023. She currently works as an IVF physician, clinical doctor, or director, I must say, at the Medical Arts Center. She is vast in her knowledge of ultrasonography, I beg your pardon, that was a tongue twister, and female and male infertility management with very good success rates. She has publications in reputable international journals and has attended several local and international conferences. She's a member of both local and international bodies, including the European Society of Human Reproduction and Embryology, that is the ESHRE, the American Society for Reproductive Medicine, and the Association for Reproductive Health in Nigeria. Ladies and gentlemen, a warm welcome with a round of applause as we invite Dr. Adebisi Oyero on stage. Please maintain that applause.
Thank you so much for inviting me for this, and I'll be speaking on what we call common gynecological problems and how they affect fertility. Okay, so I stand on the existing protocol. So let's start on the slide. Okay, so these are my outlines. All right, so let's start with definitions. When we say gynecology, we mean women. So when we say gynecological problem, we mean problems that affect women. And also infertility has been defined earlier as inability to achieve pregnancy despite adequate intercourse between a husband and a wife, or male and female, lasting about a year. And also, if a woman is less than 35 years, we'll say less than 6 months. If she's not getting pregnant, then she should start looking for what happened. All right, so like we say, women face a lot of things gynecologically that involves their reproductive health, and it starts from the, these are some of the common causes of infertility in women. I'm sure you've had at least of one or two of them, which includes endometriosis, fibroids, blocked tubes, PCOS, which is the polycystic ovary syndrome, and also pelvic inflammatory disease and the premature ovarian failure. So we'll start with one of them, which is the endometriosis. Endometriosis means that we know that when we menstruate, we have blood coming out. This blood is a tissue. So when we find it in another place outside the womb lining, then we'll say a woman has endometriosis. And then you can find endometriosis in a number of places. Okay, I'll show you a picture of places that you can find endometriosis. And this endometriosis can begin when a woman starts her first menstruation and can last until menopause. And this endometriosis, we also call it a chronic inflammation that can continue over time, cause scar tissue, form in the pelvic region, and sometimes in other parts of the body. All right. So this is a picture that shows endometriosis in different parts of the body, including the pelvic region. And the most common part that we see endometriosis is the ovary. It exists as a cyst, and we call it the chocolate cyst, which when we do a scan, we'll see it as a ground glass appearance. I'm sorry I don't have a picture of that today, but when we look on the internet, we can kind of find that. But this is a picture of where we can find different tissues, the endometrial tissue in the lining of, as in the pelvic region of the woman. So if you look at this picture, you can see the red dots. Those are the places that endometriosis occur inside the pelvis of the woman, and this is the other one that is the healthy one. All right. So in this place, I outlined the causes of endometriosis, and I don't want to bore you, okay? But this is basically it. The blood becomes trapped, and then it forms cyst. It can irritate the tissue. It causes pain, and then sometimes a scar tissue can cause infertility for those women. This diagram represents the types of symptoms that women that have endometriosis can experience. One of them is pain. Okay, so the woman, she's obviously looking like she's in pain. When the endometrial tissue is found in the bowel, she can have painful urination, she can have painful bowel movements during menstruation, pain during intercourse, vaginal bleeding between periods. She can also be very tired, abnormal and heavy menstrual periods. Sometimes she can have diarrhea, constipation, nausea, and back pain. All right, so the next one is the polycystic ovary syndrome. I have a picture here that shows the normal ovary and also the one that has polycystic ovary. Polycystic ovary simply means many cysts. And this cyst forms around the sides of the ovary, which looks like a pearl. So that's the first picture there, and the normal ovary is the one under. The follicles, which are the things that eventually become eggs, they are the ones that you see. Those dark ones are the follicles, and the other one is the polycystic ovary because they form around the periphery of the ovary. Okay, so and we have three main things that we look for women that have polycystic ovary. One of them is irregular menses. Okay, and then another one is the woman start having facial hairs where they are not supposed to. We call it hirsutism in medicine. And then another one, when we do a scan for them, the ultrasound finding of this polycystic ovary, then we can say, okay, a woman has polycystic ovary. And if we have two of them out of the three, then we can diagnose a woman to have polycystic ovary, or we call it PCOS. All right, so this is how polycystic ovaries form basically. So these are the symptoms of polycystic ovaries. Those women can experience pain also. They can have ovarian cysts. They can have acne. They can have facial hair. You see some women, they have mustache. Then they have excessive hair growth in other parts of their body. Some women can have chest hair, abdominal hair, back hair, and all that. And then acne because of the high estrogen, high androgen levels, in them. And then they can also have what we call insulin resistance. And those women, if you see them particularly, they are a little bit big on the upper side because of this polycystic ovaries. But the most important thing they can have is infertility because the egg is not they are not producing eggs every month. They have what we call anovulation. So those cysts that you see, they come every month. Like Dr. Thaddeus said earlier, the number of eggs you produce every month is already there, whether you get pregnant or not. So these eggs come up every month. However, because they don't have that ability to grow to development, so they just stay there. Instead of ovulation, they just stay there and they keep lining the womb, and the woman doesn't ovulate. And if a woman does not ovulate, then she doesn't get pregnant. Okay, so that is basically PCOS. And then we'll talk about how to manage them later. Okay, so the next one is the uterine fibroids. Everybody is aware of that. Uterine fibroids are like growths, okay, that happens inside the womb. They can be on the womb also, and they can be inside the lining of the womb. They have different names for them, and this is a picture that depicts the fibroids. So you can see this one is inside the lining of the womb. I tried to make a picture so that you can see how fibroids look like inside the womb. And then there's one on top of that. That one has a stalk, so that's one called the pedunculated one. So these are the causes of fibroids, basically. Being African, for example, is a primary cause of fibroids for most women. Just being black. In 80% of cases, a woman can have fibroid. And a woman that has not gotten pregnant before, because there's no cessation of menses at all, so she can also grow fibroid. High level of hormone, what they will call estrogen, also can cause fibroids for women. Another one is some women, they genetically, in their family, they can grow fibroids. Okay? And then women that are overweight, they are also predisposed to having fibroids. All right. So we basically know that women that have fibroids, you can have pain in the tummy, changes in their menses, which can be prolonged menses. They can have bleeding in between the menses, or they can have very heavy menses. So changes in the menses is one primary thing. Also, they have pain in the abdomen because of the fibroids growing. And the more it's growing, then it's causing pain around the areas around them. And then some women, you see them, they have big tummy. Some people were expecting them, okay, they'll give birth soon, but no, she has fibroids. Okay? And other ones are the pressure symptoms. Some women might have difficulty in urinating or even making poo. And the most important one is the infertility, because if you remember the picture I showed earlier, where the fibroid is matters a lot. If a woman has a fibroid inside the lining of the womb, it might be more difficult for her to get pregnant. All right, the next one I'm describing is the pelvic inflammatory disease. This is the disease that happens along the upper tract of the woman, especially the tubes and the uterus. So this thing is caused by infections, and infection can affect how the woman reproduces. For example, chlamydia and gonorrhea, they can cause tubal blockage. And if there is no tube, the sperm cannot meet the egg and the woman might be infertile. All right, the next one is the primary ovarian insufficiency. It was known as premature ovarian failure before, and this happens in women that are less than 40 years old. For example, you are not supposed to enter menopause if you are less than 40. You understand? So if a woman has stopped menstruating at 40 years old, then we start to wonder what is going on with this woman, and then we start looking for the causes. And if we do a scan for her, we can see the ovaries are looking a little bit smaller, and there are no hormones, especially for her to be ovulating, and the ovaries might have reduced in size. So this is primary ovarian insufficiency. The woman might not be able to give eggs, and therefore infertility can result. She also has symptoms of menopause, as if she has mood swing, irritability, and then hot flushes like menopausal women can have. So basically, depending on what we find to be the cause, the management depends on investigation. You need to see your healthcare providers. You need to find out what is causing infertility in me. You understand? And we need to do some tests, which I outline here. One of them is a transvaginal ultrasound scan, which will be able to see the womb. We'll also be able to see the ovaries as well. Then the next one, we'll do the hormone profile, because I mentioned earlier that some of those women that have PCOS, their hormone might be imbalanced. And if there's imbalance of hormones, there's no ovulation for those women. Also, we do this high vagina endocervical swab, which will help us to know if the woman has infection like pelvic inflammatory disease. Another one is the HSG to check if the tubes are blocked. And then the last one, we can do a laparoscopy, hysteroscopy, like Dr. Thaddeus described earlier, to shine a light into the womb to look at it. If there's anything there, they can take it out. So sometimes it could be diagnostic or also therapeutic. Management depends on what we find after the investigation. So the first thing I said is medical management. Sometimes we don't need to go so deep. We can give some, especially for women that have PCOS, depending on what they want. Some of them don't menstruate regularly. And if they said, doctor, I'm not ready to get pregnant yet, I just want to menstruate regularly, I just want to feel like a woman, we can give those women the pill, which is a contraceptive pill. It can help them to regulate their hormones so that they can menstruate every month. And if it is infertility that those women have, then we can suggest to them that we give them medications that will help to produce eggs in them, and then they can meet their husband, and in some cases, those women can benefit from IVF. Another thing that we can do, if it is fibroids, the woman can go through what we call laparoscopy, hysteroscopy, open myomectomy, hysterectomy, which means that those women, they can, if the fibroid is inside the womb and the woman still wants to have children, we can go for myomectomy. And if it is something that is a little bit like less than 3 centimeters, sometimes the women can take what we call laparoscopy. We don't necessarily have to open them up before they can treat this kind of fibroids. Another one that is mentioned here is the pain management, because most of those gynecological problems comes with pain. So if we give these women what we call non-steroidal anti-inflammatory drugs, it also helps them to take care of the pain. And then lastly, we have assisted reproduction in forms of intrauterine insemination, which means that we'll collect the sperm, we'll wash the sperm, and then we put it back into the womb, where the woman must have been taking drugs, we call ovulation induction drugs, and then when it's time, 18 to 24 millimeters, we can put the sperm back, and then if the tubes are open, the woman is most likely going to get pregnant. However, in some women that they don't get pregnant like this, we go for what we call IVF, where we actually take the eggs out and they take the sperm, we mix together, we call an embryo, and that embryo is being transferred back into the womb, and hopefully in 2 weeks' time, the woman comes back pregnant. And then another thing, for some women that it has passed their time and they might not be able to produce eggs again, we can do what we call donor eggs. And in some cases, some people might also benefit from surrogacy if they have problems with their womb, especially if they've had surgeries in the past, or what we call adhesions, and then it has gummed together. So, but whatever the case may be, it is advised that anytime you have some symptoms, especially the common ones, seek out your doctor, because it's important that you meet someone that is versed in these problems so that they can quickly identify and manage. Gynecological factors and problems are also related with infertility, and therefore we need to do proper diagnosis management for those women. We encourage that we seek out doctors on time so that whatever it is, we can manage it quickly, because eventually a woman is not meant to last. Okay, so if whatever it is, quickly as much as possible, seek out health care so that it can be properly managed and the options of management can be discussed. Okay, references, and thank you very much.